Ah! Oh, that's so cool.
Oh, this is probably way too big from when I was born. I was tiny. I was 4 pounds.
It says, I was born at Valleywise Health.
That's awesome.
Yeah, that's so cute.
I was born at Valleywise
Health.
Very cute.
This says, I was born at Valleywise Health.
Turn it around. Okay. It says, I was born at Valleywise Health.
I was born at Valleywise Health. Is that what it says? Yeah. It was. Good.
Hi, my name's Darlene Gonzalez. I work in the financial department here at Valleywise, and I was born here. Growing up, I would ask my mom, like, where was I born? And she's like, oh, you're born at the county hospital. And I'm like, oh, okay. I'm like, well, where is that? And she's like, well, you're born at the new county hospital, and your sister was born at the old county hospital. And I'm like, what? So she explained that old county hospital is on 35th Avenue in Durango, and I was at the new hospital, which is 24th Street in Roosevelt.
My name is Anna Olvera. I'm a health unit coordinator in labor and delivery, and I was born here at Valleywise. It's crazy sometimes when I think about it because, when my mom told me the story of when I was born, she actually ended up delivering me herself because it was that fast. Like when they took her to the room, they were asking her questions. She's like, I don't feel anything. Like I'm not feeling any pain. I'm just leaking fluid. And she said, like within 30 minutes, there I was. The nurse had stepped out and I came out. Hi, my name is Addie Munoz. I'm a project manager for the FQHCs and I was born at Valleywise. So she was new to the area and she really didn't know how the system worked at all. She was somehow directed to, it was at the time Maricopa Hospital. She ended up coming here, and what she told me is that she kind of was just grateful for the fact that the staff spoke Spanish, which was the only language that she knew at the time, and kind of gave her that peace of mind that she was going to be getting that care that she needed here.
Hi, my name is Jeffrey Flores. I'm a medical technologist at Valleywise Health, and I was born at Valleywise Health. I believe, like she said, when she was having her labor pains, it was in the morning. So they came, then they sent her back. And she came back again, they said they sent her back. Came back one more time, they sent her back. And then the fourth time, I think they said, we're staying. She has such a good place in her heart for this, for here. And so she's proud. She sees the hospital every day. She's like, oh yeah, my son's there and he's working there. And oh yeah, that's where I delivered my first baby. And so yeah, it's all good.
My name is Stacy Coates. I am a nurse on postpartum, and I was born here at Valleywise. I was born in November. It was about 3:30 in the morning. Apparently it was a very hard delivery too. I was my mom's first and she had a rough time, but yeah, that's all I've been told really. I've seen a few pictures, but not a lot. When I was little, I've always wanted to be a nurse. When I was probably about 10 years old, I made a little nurse's station in my closet, and we got little lollipops so that my sisters would pretend to be hurt and I would fix them up.
My name is Bernice Martinez. I am a human resource HR records coordinator, and I was born here at Valleywise Health. My mom was actually here for her 38-week checkup, and the doctor was like, no, you have low fluid, so you have to go in. We're gonna induce your labor. My mom had to call my dad and he said, hey, you have to come, bring all her stuff. I'm gonna be at the hospital. She says the nurses were so nice because all of the family was visiting her, and she was just telling the nurses oh, can you tell them to leave quietly. So she said the nurses were really, really nice. My mom doesn't speak any English. Well, now she does. And she says that they always made sure that there was a nurse that spoke Spanish to her to communicate with her. My mom always raves about how amazing the service is here.
Hi, my name is Ornell Fisher. I'm a medical assistant, and I was born here at Valleywise. My mom was living in Las Vegas, and she came up to see her sister. Her sister lived here in Tempe, Arizona, and so she came up to visit because my due date wasn't for weeks out, possibly even a month out. And she came up here, and within hours, I was born here. They rushed me to the only hospital that they had nearby that my aunt knew of, and here I was born at Valleywise. My mom, she already had 3 kids, so just having another kid, they told her I was going to be a boy. And when I came out here, I was this girl.
I'm Renee Clark, Senior Vice President of Managed Care, and I was born here at Valleywise. I was born here, but we moved to Ohio when I was still an infant. I grew up there and moved back to Arizona when I was in high school. Found my way into the healthcare field, working on the administrative side for many years, and 3 years ago, I wound up here at Valleywise. This is an interesting coincidence the universe has given me. I have the opportunity to come back to the place where I was literally born.
I remember calling my mom. I was like, "Mom, I'm gonna go work at Maricopa Hospital where I was born."
So funny because like I was thinking like, where should I work? Where should I work? And it was in the background of my shoulder. I was like, oh yeah, there's the hospital I was born in.
I just thought to myself how cool it would be that I would be working in a place where I took my first breath. I thought it was funny when they directed me to come here to do the onboarding, and I kind of just was telling everybody, by the way, I was born here.
How I got in the medical field was I was playing with my cousins and stuff, and we had a needle. My grandma had a sewing kit, and I used to poke them and stuff all the time. Come into my office, and I would poke them. And then my mom was like, she's probably going to end up in the medical field. My mom worked at the only hospital that Holbrook, Arizona had, and I just started loving the passion of helping people and seeing people come in and talking to them and hearing their story. And that prompted me to grow up and put myself through the medical field.
I love it. You get to know the patients because they come in, even like the ladies that are expecting, I'm like, oh, when are you due? And even when the new hospital wasn't open, I'm like, oh, you're going to have the baby at the new hospital.
My favorite part is the babies when they first come over. It's just really nice to help out, and there's a lot of teaching parents how to breastfeed and how to take care of their baby, how to take care of themselves. So babies will always be my favorite part.
I became an executive assistant for the vice president of ambulatory in 2021, and that's kind of when it started to hit me like, oh yeah, I was born here, and then I hear the music playing. And then kind of just takes me back to like, oh, well, what did my mom feel when she had me here? So it is kind of always like in the back of my mind.
Especially when you hear the back to back to back. Think about their families and them and like what's going to happen in their future.
I just light up every time. I love it.
I was born in 1971, and that's when the hospital opened in 1971. Kind of gives me the chills, but because it's kind of neat,
I was born here on April 3rd, 1972. So I arrived when this hospital was brand new. And now working in this new building, when I see the new moms and the dads and the families coming in, I hear their comments like, oh, it's so nice here. I just think to myself, wow, like with my mom doing the same thing, like when my dad came to see me or family, I always wonder to myself, were they like looking around thinking, wow, this is a really nice hospital, because it was brand new.
We get lots of patients with different cultures and different needs. It really keeps the nurses, on their toes to make sure we're meeting their needs, especially with some of our language barriers as well. Knowing that you can make a difference and feel someone can feel respected and cared for, regardless of what their culture or language is. It's very important to me.
That means a lot to me because, like I said, my mother, when she delivered here, she didn't speak any English. So the fact that we serve a very diverse population here, it means a lot to me because I know that Valleywise really does appreciate the diverse culture here, and I know that they go out of their way to try and understand it as well. And I'm proud to be a part of that. I can easily place myself in their shoes because I grew up in this community. I feel like I can relate to them more, and I really believe in the Valleywise mission, and that helps me feel like I am doing my best in what I do now to help them get the care that they need.
The more I got into the interview process and after I started working here, the sentimentality of it hit me, is that, my mom wasn't in a good place when she had me, and this was her only option. And I get to give back to people who might be in the same position.